Week 11 Minute Review. Transtheoretical model. Their 6-stage process to behavior change. The progression through the stages is not always linear, and a person might recycle through the stages several times before change is achieved. Pre-contemplation stage. The patient has no intention of changing. Nurses can respond with empathy and patience while offering hope. Nurse can educate on risks of not changing. B. Contemplation stage. The patient acknowledges need to change but is anxious about it. The nurses can respond with providing information, clarifying goals, and acknowledge the mixed feelings they have about it. Preparation stage. The patient begins to explore different options or ways to change. Nurses can help by making realistic plans about how to handle relapse and reiterate the benefits of change. Action. The patient changes behavior. Nurses can help by affirming and support and offering substitute alternatives to the old behavior. Maintenance stage. The patient continues the change, but relapse is a real concern. The nurse can help by helping patients view the lapse as learning opportunity without imposing guilt. Termination stage. The patient revises self-image and the former behavior is no longer a threat. The nurse remains alert to risk of old behavior and continues to promote the patient's self-efficacy. There are 5 A's to tobacco cessation. A. Ask all questions every visit if they smoke. Advise to quit in a clear, strong manner and include how smoking is affecting them. Assess willingness to quit now. Assist with a quit plan using STAR. Set a quit date within a 2-week period. Tell everyone. Have patient tell everyone that they are quitting and need support. Anticipate challenges. Nicotine withdrawal is intense. And remove all tobacco products from home. Avoid places where you usually smoke. Arrange for follow up with the patient. The 3 domains of learning. Cognitive is the mental skill where the brain must use to perform intellectual tasks. Psychomotor, physical skills such as movement, coordination, manipulation, dexterity, grace, actions, etc. And affective, described as coming from the heart, knowing if nothing is there is no will to act on it. Positive interviewing techniques, how it helps the patient, and an example. Offering leads is an opportunity to speak freely. Tell me what happened. Restating, an opportunity to clarify. You started coughing after eating. Reflecting, opportunity to add. Is there anything else you're feeling? Focusing, opportunity to link symptoms to a health concern. Did you notice the swelling in your legs the morning after you ate the Chinese takeout? Clarifying, opportunity to validate. So this headache is the worst you've ever experienced? Sequencing, opportunity to create a timeline. Did you feel dizzy before or after you passed out? Encouraging, opportunity to affirm patient's value and input. What is your goal for today? Encouraging evaluation, opportunity to affirm patient's ability to assess their situation. What do you think caused your coughing? Making observations, opportunity to aid patient in seeing blind spots. Your blood pressure was high today. Are you remembering to take your hypertension medication? And summarizing, opportunity to clarify what is important. So yesterday you felt fine, but this morning you started feeling dizzy. Negative interviewing techniques, how it hurts the patient, and an example. Why questions. They're often judgmental. Why haven't you quit smoking? Giving advice, often unwanted. If I were you, I would. False reassurance, often invalidates feelings. Don't be afraid, everything will be fine. Using cliches often shows disinterest in genuine connection with the patient. Well, tomorrow's a new day. Defensive response, often unempathetic to the patient's complaint. I'm doing the best that I can. We are short-staffed anyways. Leading questions often makes it difficult for the patient to disagree with you. You don't drink more than socially, do you? Using jargon, often confusing the patient. Have you been NPO for your cath today? Red flags for low literacy, frequent missed appointments, incomplete registration forms, non-compliance with medication, unable to name the medications or explain the purpose or dosing, identifies pills by looking at them, not reading the label, unable to give coherent sequential history, asks fewer questions, and the lack of follow through on tests or referrals. The nurse's role: use simple terms to explain concepts, speak in a layperson's term, avoid jargon, use a teach back method. Nurses' role in quality improvement, Be open to change. Know your benchmarks. Participate in teams that evaluate the process involving multiple departments. Put aside personal agendas and seek to understand other team members. The NDNQI, the National Database of Nurse Quality Indicators, is the national benchmarks that monitor patient falls, acquired ulcers, and hospital-acquired infections. Transformational leadership is effective leadership. The leader empowers members using intrinsic inspiration and motivational leadership. And that's it. That was week 11.